everyone, thanks so much for tuning in today. This is a real quickie. I'd love to introduce you Marie James, who is a star when it comes to epilepsy and those with learning disabilities, specifically in Wales. And there's a real palaver, to put it politely, going on at the moment. Marie, could you please tell us about yourself and this palaver that's going on?
Hi, well, thank you, Tori, for the invite to have a chat today. Very, very much appreciated, because it's an exciting day for us. It's SODEP Action Day, and we in Wales, specifically in the Hywel Dda Health Board area in Wales, are having specific problems at the moment with the loss of service, and this is affecting 170 patients, and of course the knock-on effect with their families as well, and carers. So we have been trying for the last 4 months actually to seek answers from the health board about what plans they have following an abrupt withdrawal of service in June. Now, this service was a life-saving service, it was a life-enhancing service, and as we know, people with learning disabilities are living longer, and it is so important that their quality of life is a good one. It's not just a matter of managing things for them. They need the best possible opportunities to access the best possible health care, and to have the issues around epilepsy dealt with by a specialist who is able to guide us, who's able to do the necessary risk assessments for such things as SODEP with us, to have time to chat to us when we are having appointments, when we're going through the process of maybe looking at new medications and discussing holistically what that might mean to somebody with a learning disability, because the complexities involved in somebody having medication, and the issues around not being able to say maybe how they're feeling and what's going on, very often results in behaviours that are deemed to be challenging, whereas there's something else going on there.
Totally, and I actually spoke to somebody recently about something like this, Rohat Shankar, and he was telling us about the whole issue when sometimes you do have people with learning disabilities or intellectual disability, or issues even verbally or issues cognitively. It's very hard for people often to express what they're going through. And it can be really hard, I think, for carers as well to know what's going on in the body of the person that they love. So it's crucial to have that extra time with the specialist, right?
Yes, indeed. We very often second guessing or best guessing with underlying triggers for everything that's going on, and between the learning disability, possibly autism as well for many of the youngsters involved or young adults involved, and also the complexities of medicines and combined medicines, because it's easy maybe to distinguish when you have one medicine and that you are looking at the side effects, but when you are taking 5 or 7 medications for the same symptom, and untangling everything that entails, you really do need access to specialist care. And in our case, we had fantastic service with Professor Micah up until June, when the service was withdrawn by the Health Authority. We were very fortunate. My son had been accessing the clinic for 18 years. And you build up trust and faith in the consultants that you see. Tristan, my son, is 34. He sees 9 different consultants, but of those 9, only 2 are specialists. And the different service that we have from the specialised services is significant, and it makes accessibility for Tristan to have that kind of input from healthcare is so important. The clinic appointments are extended so that you have the time, as we spoke about, and not only that, it's accessibility as well, so being able to access appointments and to see the actual consultant on these occasions. Very often Prof Kerr might come out to the car to see Tristan, and I know he does so for he was doing so for the other patients as well, when Tristan wasn't able to go into the building. And on some occasions we were able to divert to other locations happens because in Penlan, in Carmarthen, there was an outreach clinic for a time, and we were able to access the service from other places when Tristan wouldn't go into that building. So all of those tweaks, the reasonable adjustments that everybody speaks about that are important, really are, I mean, it makes such a difference. And things like waiting rooms and areas, you need quiet areas very often if somebody has sensory issues, and you need to be able to know what sort of environment you're walking into, and that it's not always possibly a hospital environment. You know, the clinics were at the community team, learning disability team offices, and that was accessible. It wasn't a hospital environment, which many find difficult to access. And of course, Prof Kerr did domiciliary visits as well, which, you know, for us have been particularly beneficial over the last few years.
Just tell us just a quick bit about the tuberous sclerosis that your son has, please.
Yes, of course. Tristan developed infantile spasms when he was about 3 months old, had a diagnosis of tuberous sclerosis complex at 8 months, and he's now 34 years old, nearly 35. So over the years we've seen changes with seizure types. He has frequent seizures, daily partial seizures, and weekly tonic-clonic seizures as well. So managing seizures is difficult because it's intractable. He has intractable seizures, difficult to manage seizures. We are on a baseline of 4 medications at the moment, and he has another 2 emergency rescue medications to hand with different guidance for those. Tuberous sclerosis is a genetic disorder that affects any of the systems of the body with growths. And Tristan, typically, like many others, has tumours on his brain that cause autism, epilepsy and a learning disability. He also has tumours on his kidneys and has had tumours on his heart as well, so, and facial tumours. So it's a multi-system disorder that can have an individual affected severely or very, very lightly, and in fact many don't know that they have the condition until maybe they go on to have a child who presents with a more severe form of tuberous sclerosis complex.
Why did your son have this wonderful, wonderful clinician supporting him and all these services together, and then suddenly gone? What made this occur?
They are the answers that we are seeking from the Health Board, or part of the answers that we are seeking from the Health Board. My understanding is that a clinic nurse retired, the long-standing clinic nurse retired, a CTLD nurse, and that support for continuity of that clinic nurse support wasn't there. So therefore, the service was compromised and it was withdrawn.
This is really strange to me. And you know, like, I really do empathise with this situation because, like, I went for 2 decades personally, this is my personal story, 2 decades with generally rubbish neurologist and with a high risk of sudden unexpected death by epilepsy, which is today is where we're creating awareness of that with SUDEP action, right? And so I really get what it can be like to be lost and your seizures are getting worse, your comorbidities are getting worse as well, which is often seen as a sort of just like a sideline, which is wrong. But then you meet the person like Professor Kerr, or in my case it was Miss Tim Boehner, who pretty much kind of saves your life and that makes life worth living. And that is what you know, it's not about just existing, it's about wanting to actually live and enjoying the life that you live. And that's what your son and everybody else like him deserves, just like you and I, right?
We had the very best possible of care with Prof Kerr, and it has saved us from unnecessary hospital admissions many occasions over the years. So it's financially, I would have thought, financially a very good move to keep such a fantastic service. But for as regards the SUDEP issues, very important to be open and aware of those issues, and the risk assessments and management that can be done, because that's so very, very important, and the supervision and reviews of those risks as well.
I think for many of us who don't have learning disabilities or other comorbidities impacting our ability to make decisions and care for ourselves, even for us it can be really challenging, especially if you have refractory epilepsy or still having seizures, to kind of think, okay, this is happening, what is my risk of SUDEP or injury? And again, that's why we need more people like Professor Kerr to be looking after your son, be there for your son, and I think provide support effectively for mums and dads and carers like you, because otherwise you're kind of left on your own, right?
Yes, the second guessing again, it's so very, very difficult, and you need to be able to have access to people who understand that and help you untangle the complexities around medication and behaviours.
For any clinicians listening or politicians, you know, we're not doing this video to moan, we're just saying this is our need. This is what is required now, and we're going to save you some dosh and time and moaning in the future if you kind of like help us out now and, you know, kind of consider human rights and all. That would be great. So yeah.
Thank you, Tori. The parent carer group have exhausted the usual avenues that we can. We would never have come to social media to raise this were it not, you know, were we not hitting a wall as regards not getting answers or not getting satisfactory answers and having platitudes instead of action. And it's long overdue. We've been 4 months now without a service. We need to know what's happening. And we need clarity and the answers to our questions as well, because it's been too long without a service, and each and every seizure that we witness gets harder and harder, because we know it's inevitable that we were going to land up in A&E at some stage, rather than have specialist expert advice that is given very, very quickly in circumstances where needed.
What action do people need to take right now? What can they do to support you? Little and large.
Well, today, SUDEP Action Day, we have organised a virtual sit-in together with lots of help from the rare disease community and from the SIRD sector as well. Organisations been very, very supportive. So the parent group have formed a Save Our Specialist Epilepsy Learning Disability Service group, and we have a virtual sit-in between 6:30 and 7:30 tonight, and we are asking people to please join us, enable to show the Health Board that we have support in this, and that we are not lone voices, that we're not silos, and that we won't be silenced. For the sit-in, we have links to our social media sites where we will be posting throughout the hour, and we're actually started to post now the information so that people can share, they can follow, they can retweet, or actually send messages directly to the Health Board using the hashtags that we have, and linking tagging the Health Board in that as well. All support really, really appreciated, because our 170 people who aren't able to speak for themselves, that their voices get heard and that they get the service that they so deserve.